So hi everyone, my name is Janet and I'm a registered pharmacist, and today I'm here to talk to you about falls prevention. So you may be wondering, well, what do medications have to do with falls prevention? Medication use is a fine balance. On one hand, it can be very helpful. It can help us treat symptoms and manage our diseases. On the other hand, it can also cause us harm, such as increasing our risk for falls as we get older. That's why it's important to weigh the benefits and harms of taking a medication, any medication, over time. Medication overload means taking more medications than we need. It can also mean taking too many medications that collectively or together cause more harm than good. Is there such a thing as taking too many medications? There's no strict number. Sometimes we have to take more than one medication to treat a medical condition, such as our high blood pressure or diabetes. However, if even one medication that we take can cause more harm than good, it can be one too many. Medication overload or polypharmacy can increase our risk of harmful side effects as well as drug interactions. And an analogy that I like to use is to think of the balls on the pool table. So think about the pool table and how each ball can represent a medication. When we only have one or two medications, so one or two pool balls, it is easy to see where and how the balls will, whether or not they're going to hit each other and where they're going to go. However, as we add more and more balls to the table, so more and more medications into the mix, it's hard to see when they collide, where they're going to go and where they'll end up. And so that's how we like to think about, medication overload and the increased risk of drug interactions and side effects. Medication overload can increase our risk of falls, fractures, loss of independence, hospitalizations, and it can also increase our risk for confusion and or memory problems. Those at highest risk of medication overload include those who are on multiple medications, older adults, and women. As we take more medications, our risk is greater for experiencing harm, such as falls, fractures, and loss of independence. So what can you do to lower your risk of harm? As we age, the benefit to risk ratio of medications may change. And so deprescribing is something you can consider, where you meet with your healthcare provider or your physician and talk about whether or not you can stop or reduce a medication that you feel is harmful or no longer benefiting you the way that it used to. I highly encourage you to ask the following 5 questions whenever you're starting a new medication or even if you're reviewing your current medications. The first question is, why am I taking this medication? The second question is, what are the potential benefits and risks of this medication? The third question to ask is, can it affect my memory or increase my risk for falls? The fourth question is, can I stop or reduce the dose of this medication? And lastly, who do I follow up with and when? To learn more about falls prevention, please be sure to check out our other videos. And if you'd like to learn more about deprescribing and medication safety, please visit www.deprescribingnetwork.ca. Thank you.